just take this is a light. It's going to go deep, right into the joint. Okay, it's going to go in, and it's going to start healing and calming the nerves down. All right. Place.
What about the neck? The neck.
We're going to address it all. Let's have you.
Because I'm also more concerned about my migraine. You know.
Yes.
Issue that I'm facing for a long time.
Can you feel that?
Mm-hmm.
Let's have you sit straight, arch back, bend back towards me, bend forwards, forward, more. Bend back, more, back against my hand. Yes. Forwards, all the way down. Back up, all the way back. Good, forwards. Come up for me. Now I want you to twist your body, sit up straight, twist your body to face me this way, and then twist your body opposite direction. Go. Other side. Keep going. Twisting your body. Twist. 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 And twist. Good. Other side, please. Perfect. Lie on your back, facing up, face up. Let's check that out. Perfect. Come on up.
There was a guy in Pakistan. He was trying to be a chiropractor. Huh? So he did something after I was having problems. So I have to do this, what do you call, physiotherapy and all for a long time. It was painful.
You tried somewhere else? Or that was...
No, he was just a local guy who do massage, you know.
Yes.
He put his knees in my back and he do like, after I fell down, couldn't move myself, and then I have to take an injection to move, you know.
I'm not, I've never learned that technique myself. Yes, I've never, in my training, in my clinical experience, I've not learned that technique.
No, he was just, you know, trying to be some chiropractor.
I see.